Very difficult stories to hear because we know these people are desperately trying to help others. But what do we know about the incidence of depression or other mental health problems in frontline workers during this pandemic specifically, Payal?
So, Tom, some data has emerged out of China that's told us a little bit about the mental health toll that this pandemic is imposing. And this is a study of 1,200 1,200 doctors and nurses who worked in a Chinese hospital system and were caring for COVID patients. And what they found was that 12% of them actually had moderate to severe anxiety, 15% of them had moderate to severe depression, and 1/4 to 1/3 of them actually had mild symptoms of anxiety or depression. So definitely a high burden of mental health problems. There also were some risk factors that appeared to emerge. So females more than males tended to fall risk to depression, anxiety, or PTSD. And similarly, healthcare workers more than non-healthcare workers are more at risk. And finally, if you have a history of prior mental illness, that increased your risk as well. So if you think about Dr. Breen, she did have 2 of those 3 risk factors. She was a woman and she was a healthcare worker, and certainly such a tragic loss, but it does illustrate for us that the frontline workers are very much human, just like everybody else, and prone to these mental health effects just like everyone else.
Especially with the onslaught of the cases in New York, you'd have to imagine that you never had a chance to turn it off. Even when you did leave the ER, if you ever did get to go home, that it was still omnipresent in your mind or in just the sights and sounds of New York City. And it almost was something that would never let up.
That's exactly right, Tom. And in fact, doctors live on the edge of life and death every day. And it's something we were trained in medical school to do and to learn how to cope with. But when it comes at that sort of volume, where firstly, you feel overwhelmed yourself, and secondly, you feel like you can't help those patients that you're trained to help, it can really, really take a toll on you.
So we think of blood tests and MRIs and x-rays that show us what is or isn't wrong with the human body. With the human mind and the human, emotional structure, there really is no certain number or tests. And you're really relying on people to talk about it and let people know that they're struggling. That has to be especially tough for someone who thinks that they're supposed to be there helping all the time.
Yes, that's very true. And many doctors are actually told to put aside their personal problems. Check your baggage at the door is what they say, because you're not there with your problems that day, whether they're physical or mental problems. You're there to take care of the patient in front of you. So that process of internalization often does lead to that just building up pressure and erupting inside you. And as we're learning more and more about COVID, we're learning that there are certain risk factors from COVID itself that maybe predispose you to depression as well.
I'm going to ask you about the long-term effects, because this will one day pass and people will hopefully have dealt with it as best they can. But long-term effects of a pandemic on mental health, is there anything we can do to curb those effects as well?
So, Tom, we don't know a lot about COVID itself and the long-term effects because it's a relatively new pandemic, but we do have some information from SARS. And that basically showed us is that 3 years after the SARS pandemic ended, the mental health problems were still persistent in healthcare workers. In fact, 1/3 of them who had mental health issues during the acute episode continued to have them later. And as we're learning more and more about COVID, we're seeing that there are risk factors from the COVID that can occur, beforehand, because you're lonely. There's fears about money. There's fears about spreading the infection. They can occur during the acute infection because the infection itself actually can get into the central nervous system and cause neuropsychiatric effects. And then, as was the case with Dr. Breen, it can occur immediately after the infection because you get a post-viral fatigue that sets in from the inflammation. And we've all experienced this when we've had a bad flu or something where we feel tired, and that can precipitate a depression. But the most important message to get out there for everyone is that if you're feeling any of those symptoms of depression, whether that's before you're infected, during the infection, or afterwards, it's really important to reach out and get help. And it's really important to keep in mind that we will all get through this together. So reaching out for resources while you're feeling those symptoms can really curb the problem from becoming a bigger problem. And that's a theme during this pandemic. You can treat the smaller problems, but don't let them become bigger. And doing so early will really improve your long-term outcomes.
And there on your screen is one place that you can certainly reach out to and get help. whether you are someone who is just struggling with your own
Thank
issues
you.
or if you are a healthcare professional as well. Payal, thanks as always.